Ebola virus disease, from Wikipedia, the free encyclopedia. Ebola virus disease, EVD, or Ebola hemorrhagic fever, EHF, is the human disease caused by the Ebola virus. Symptoms typically start 2 days to 3 weeks after contracting the virus, with a fever, sore throat, muscle pains, and headaches. Typically nausea, vomiting, and diarrhea follow, along with decreased functioning of the liver and kidneys. At this point, some people begin to have bleeding problems. The virus may be acquired upon contact with blood or bodily fluids of an infected animal, commonly monkeys or fruit bats. It is not naturally transmitted through the air. Fruit bats are believed to carry and spread the virus without being affected. Once human infection occurs, the disease may spread between people as well. Male survivors may be able to transmit the disease via semen for nearly 2 months. In order to make the diagnosis, typically other diseases with similar symptoms such as malaria, cholera and other viral hemorrhagic fevers are first excluded. Blood samples may then be tested for viral antibodies, viral RNA, or the virus itself to confirm the diagnosis. Prevention includes decreasing the spread of disease from infected monkeys and pigs to humans. This may be done by checking such animals for infection and killing and properly disposing of the bodies if the disease is discovered. Properly cooking meat and wearing protective clothing when handling meat may also be helpful, as are wearing protective clothing and washing hands when around a person with the disease. Samples of bodily fluids and tissues from people with the disease should be handled with special caution. There is no specific treatment for the disease. Efforts to help persons who are infected include giving either oral hydration therapy, slightly sweet and salty water to drink, or intravenous fluids. The disease has high mortality rate, often killing between 50% and 90% of those infected with the virus. EVD was first identified in Sudan and the Democratic Republic of the Congo. The disease typically occurs in outbreaks in tropical regions of sub-Saharan Africa. From 1976, when it was first identified, through 2013, fewer than 1,000 people per year have been infected. The largest outbreak to date is the ongoing 2014 West Africa Ebola outbreak, which is affecting Guinea, Sierra Leone, Liberia and likely Nigeria. As of July 2014, more than 1,320 cases have been identified. Efforts are ongoing to develop a vaccine, however, none yet exists.